I'll do a test, okay? Test, can you hear me? Great, okay. Good afternoon and welcome, everyone. My name is Bridget Mahoney. I'm a former board chair of the Ohio Domestic Violence Network, and I currently serve as the chair of the Public Policy Committee. We are so grateful you're here today as we release new and very significant information. Today, we are putting a spotlight on a component of domestic violence that has essentially been hidden in plain sight. Our focus is the profound financial impact on not just the victims, survivors, and their children, but also the staggering, wide-ranging economic impact of domestic violence throughout Ohio. To get a better understanding of where Ohio stands, ODVN asked research economist Dr. Joseph Von Nessen from the Darla Moore School of Business at the University of South Carolina to conduct a study for us. Dr. Von Nessen has done similar work for 3 other states. Well, when he came back to us with his numbers, we were astonished. They were even higher than we anticipated. Domestic violence costs Ohio $1.2 billion a year. The economic impact is as pervasive as domestic violence is. The highest costs come from the medical care of a victim, loss of life, and worker productivity, and the high costs inflicted by the abuser on our society, police, court costs, jail, imprisonment. Featured in the study are the substantial costs to businesses and the ripple effect felt in our communities. While you may not experience domestic violence firsthand, you are indeed affected by it economically. Everyone in Ohio is. Now to share highlights of his study, Dr. Joey Von Nessen.
Well, good afternoon, everyone. I also want to thank you all for being here today and for inviting me to participate with you, and especially thank the Ohio Domestic Violence Network. My name is Joey Von Nessen. I am a research economist with the Darla Moore School of Business at the University of South Carolina, and appreciate the opportunity to share this important work and the findings from this new study that documents the economic impact of intimate partner violence in Ohio at both the state and the county levels. Through this research effort designed to highlight the cost of domestic violence to this community, to the state, and to residents, we hope to support a call to action to engage in more prevention and more support initiatives, knowing that one victim of intimate partner violence is one too many. So I'd just like to spend a few minutes with you this afternoon summarizing the key findings that emerged from the study that we've been conducting over the last several months. First, intimate partner violence is far more prevalent than is commonly known. In Ohio specifically, approximately 38% of women and about 33% of men will experience intimate partner violence at least one time during their lifetimes, according to the National Coalition Against Domestic Violence. Intimate partner violence is also more common in Ohio relative to the nation as a whole. We specifically estimate in this study that there are nearly 189,000 victims of intimate partner violence in Ohio each year, including over 21,000 in Franklin County alone. Additionally, 114 lives were lost in the 2024 fiscal year between July 1st, 2023 and June 30th, 2024. And these numbers, unfortunately, represent conservative estimates. Another important fact about intimate partner violence is that it's a crime that usually happens in private. In addition, victims are often reluctant to tell anyone about what is happening. Therefore, the number of reported victims is almost always an underestimate of the actual incidence of intimate partner violence. Second, we estimate in this study that the specific total annual cost, as Bridget mentioned, of intimate partner violence in the state of Ohio to be $1.2 billion each year. The annual cost of intimate partner violence on the state of Ohio is approximately $1.2 billion each year. Now, this number includes multiple factors, what we call the explicit costs, as well as the hidden costs of intimate partner violence. Now, explicit costs, those are ones that we are generally most familiar with. So these refer to things like program initiatives, shelter programs, general support mechanisms to improve public awareness of domestic violence, and the warning signs of potential violence that individuals may face in the future. Explicit costs also refer to healthcare and other support services that help victims following a domestic violence incident, as well as police and court costs associated with intimate partner violence incidents. And the single biggest cost category stemming from intimate partner violence in Ohio are those related to healthcare. That is, the costs associated with healthcare needs of the victims themselves. And this represents roughly 22% of the total statewide economic losses stemming from intimate partner violence. Specifically, in this study, we captured several categories of explicit costs. Some of these I've mentioned already, but officially we look at them as costs related to physical health care, mental health care, the loss of property, policing costs, court costs, incarceration costs, child welfare, other programs, shelters and centers, and finally, volunteer opportunity costs. So the costs associated with volunteer hours that are contributed to prevention and to support. But there's also a second category, in addition to these explicit costs, that we refer to as hidden costs, which refers to the harm of the general well-being of victims from not being able to return to their normal lives, either temporarily or in some cases permanently. Now, it's impossible, of course, to fully capture or measure these hidden costs, but this study does examine the losses to worker productivity associated with intimate partner violence incidents as a means to quantify the extent to which victims are forced to temporarily or permanently adjust their working lifestyles. And this is one way that we can provide a conservative measure of what these hidden costs look like. Specifically, we estimate in this study that these hidden costs are approximately $468 million annually, which represents about 40% of the total cost of intimate partner violence in the state of Ohio. Now, approximately half of this total represents the estimated loss in lifetime earnings for those victims who lost their lives, while the other half represents losses in wages due to a victim's temporary absence from the workplace for the purposes of recovery and rehabilitation. And all of these impacts also include what we refer to as multiplier effects, economic multiplier effects. So when employees are missing or are less accessible in the workplace due to any type of injury or any type of challenge, whether it's related to intimate partner violence or otherwise, this can reduce the productive capacity of the employer and thus can lower the employer's overall output levels. And this in turn can subsequently lead to a decreased volume of purchases made with the employer's vendors and thus reduce demand more broadly, which can in turn impact the broader rate of job and income creation in the local economy. So it's these secondary effects on demand that represent what we call multiplier effects, and those are important to capture as a component of these losses as well. And this is yet another reason why the impacts of intimate partner violence can be sometimes underreported. Third, there's a need for intimate partner violence prevention and assistance in every county and in every region of Ohio. This is a statewide challenge. It's a statewide problem, not just a problem for rural counties or just for urban counties. Now, it is certainly true that the largest losses stemming from incidents of intimate partner violence occur in the major population centers, but intimate partner violence occurs in every county in Ohio. 32 counties specifically had fatal incidents of intimate partner violence in the 2024 fiscal year. So it's critical for us to make sure that there are sufficient resources for prevention and support services within reach of all people across the state. So in conclusion, I'd just like to once again thank you all for being here today, and especially to the Ohio Domestic Violence Network for allowing me to be part of this important work. And now I'm going to turn it over to ODVN's Executive Director, Mary O'Doherty.
You're going to stay here. So now you know domestic violence costs Ohio $1.2 billion. Does anybody have any questions for Dr. Van Nessen? No questions? No questions? Any from the live streamers? Okay. Well, this seems like a really good time to point out that ODVN's 76 member programs receive $10 million a year in state funding, support for which we are eternally grateful. But please take a minute to compare those numbers. We get $10 million a year to provide services for an issue that costs our state $1.2 billion. Next month, advocates from across the state are going to come to the State House and meet with their legislators to thank them for that support and to urge them to preserve that funding when they build the 2026-27 operating budget. We'll use these findings from the study to make our case for continued state support. We'll also tell the legislators that we served more than 127,000 survivors in 2023, and that we sheltered nearly 10,000. But we'll also say that our programs turned away about 8,000, actually more than 8,000 survivors, which means that nearly 1 in 2 survivors who went to a shelter to get help were turned away because there was no room or capacity to serve them. With our federal funding threatened, it is impossible to overstate the importance of that state support. Thank you guys for attending our press conference. We appreciate your help in getting word out about this really important study. Thanks very much. Oh, you have questions for me, but not for the doctor. Oh, that's what I was afraid of. Okay, I was trying to get it, sneak out.
Police forces, can you talk about what?
Those are, well, there are federal funds. I'm sorry, I just wanted to clarify, there are federal funds that come through the Attorney General's office, and there are federal funds that come through the Office of Criminal Justice Services. But those are federal dollars. So the dollars I'm talking about are the only state dollars, and they're general revenue dollars. But did you have a question beyond that? I don't know if I can come up with that off the top of my head, but I could try to find it out for you, but. Why are they at risk right now? Because we have a new administration that has severe doubts, I think, about the way that we fund our federal services, or at least he has people around him who have those doubts. Right. I mean, we get lots of the federal funding that we were talking about, those VOCA funds, those funds that come through the Office of Criminal Justice Services, those come from a funding stream called that operate under the heading of the U.S. Office of Violence Against Women, many different funding streams. But those have been highlighted by, they were highlighted in the Project 2025 report, which I'm sure you're aware of. So we're concerned.
We've seen in the last 2 years, especially in private practice, are you able to talk about how that's fluctuated, the amount of money that's being spent for domestic violence, specifically in Franklin County?
Sure. We're going to let Lisa DeGeeter, our policy director, field that one.
Yeah, and so you're exactly right. What we saw during the pandemic was numbers go up. And we understood that during lockdowns and situations that would happen. And we expected eventually post-pandemic that those numbers would drop. And that's what we're not seeing. So not only are numbers for demands for services not decreasing back down to pre-pandemic levels, they are continuing to escalate. We are watching some programs have 30, 40, 50% more requests for services in the last state fiscal year than they did previously. And we really don't have a good explanation for that. But the counterpoint is, so this request for services is going up, and federally, those dollars in these grant programs that we depend upon have been reduced over the past 6 or 7 years. So we're watching both in the Violence Against Women Act, there's VAWA money and there's FIPSA, the Family Violence Prevention and Services Act money, and then there's VOCA money, which runs through a different part of the Department of Justice. But we're watching all of those fund balances and all of those allocations be reduced. So there's an increased demand, reduced money at the federal level, and that's a big part of why it was 6 years ago that we finally got into the state budget to help rectify and remedy those problems. But we are losing tens of millions of dollars, and the first go round we were in the budget for 1 million. So we're very appreciative because we've consistently either stayed level or increased funding through the bienniums as we have asked for funding. But the increase that the state is picking up is not keeping pace with what we're losing federally. And even if we had the federal money we had 10 years ago, it would not keep pace with the demand that we're seeing. So that's what we wanted to do, is put some context around this.
The amount of people that served in 2020, the amount of people shelter, the amount of people that had been turned away, excuse me. What would you say this increase, what would you say the biggest impact on what you guys do on your day-to-day is from this increase in need demand for services?
On the day-to-day for our member programs, I think there's an emotional cost to having turned people away because you don't know, they're not showing up on programs' doorsteps because they have other alternatives. If they had other alternatives, that's what they'd be using. That's what they would be availing themselves of. So when you turn someone away, they're either going back into abusive situations. That's why we're also watching the homicide rate, which used to be 80 or 90 folks a year and peaked during the COVID lockdowns around 130 people, still stay in the 100 teens and not drop back down. Because if people can't get served, they go back. And they go back into really risky situations, and it's not an overstatement to say they're risking their lives because we're watching and counting that. And so it's turning people away. We literally have about 20% of our programs that can't answer the phone every time it rings for their hotline because their staff is so extended between web chats and crisis calls and dealing with folks in shelter, and they're understaffed at that level. We have a handful of programs that aren't staffed 24/7. So if law enforcement breaks something up at midnight, they can't bring the survivor into services until 8 o'clock the next morning because there's not somebody there to answer the door. We're watching programs get rid of or cut children's programming because there's the things that they're not superfluous. There's definitely needs there in those populations, but children's programming, mental health, prevention work, if you're trying to keep the lights on and people fed because people are walking in with nothing but the clothes on their back, that's where you have to direct the resources first, is that immediate need. And when you're struggling to meet that immediate need, so much of the other work that is really critical to getting people back on their feet and keeping families together gets missed.
The 2026 operating budget, are you all asking for the same amount of money, 10 million, or are you asking?
We initially asked for 40 million, so a double to 20 million a year. The money that ODVN receives and in turn passes out to our member programs, it actually runs through the Attorney General's office. They manage it. And we made that ask of Attorney General Yost and of Governor DeWine, but all of the state agencies this year were told to keep their budgets balanced and even because of the tax projections, the revenue projections for the state. So we are, at this point in time, we are grateful that we're still in at the 20 million, 10 million a year, because we knew that cuts were a possibility given everything that they're looking at. So we're extremely grateful to both Attorney General Yost and Governor DeWine for keeping us in so that we can continue to do what we have been doing. 10 million a year, 20 million for the biennium.
That's official.
Yes, we know that we're in the red book. Yeah.
Do you ever see numbers going back to those pre-pandemic level? I mean, you mentioned demand going up. What's it gonna take to get back there or less?
Well, if we knew the answer to that question, then we'd probably be in another line of work. I mean, there are no easy answers, unfortunately. And when the numbers go up, you have to ask yourself, why is that? Is it because our programs are doing a better job spreading the word about their services? And so, domestic violence wasn't necessarily increasing. It was just that the people who were always experiencing it were going to get help. Maybe we've done a good job or a better job reducing the stigma around domestic violence. So people feel more comfortable naming it and getting help. We really don't know. But I think our services are going to be needed for a long time to come, though. Anybody else? All right, no more questions, no questions for the professor. All right. All right. Thank you guys for coming. Appreciate you very much.